Hey, episode one. We are of our unnamed podcast. I'm Adam Holsworth, doctor of physical therapy. This is my partner, Dr.
I'm
Vahid.
yeah. I'm Vahid. I'm a physician. That's pretty much it.
Just a general
This is
physician.
going really well already.
Yeah,
All right.
I'm just a physician of all. So you
Of all,
specialize in all the specialties.
actually, yeah. So family medicine, obesity medicine, and lifestyle medicine.
Perfect,
Yeah.
perfect. Well, yeah, we wanted to get together and chat about a number of things, but there seems to be so much misinformation and poor information and confusion out there surrounding a lot of health and wellness topics. I think it'd be cool to start addressing some, how it affects us personally, how it affects our patients, and the type of practice and care that we provide. Yeah, any hot topics from you today that you would find interesting to discuss with a physical therapist?
Um, that's a good question. I should have been way better prepared. I'm just kidding. No, definitely. I have questions for you. So, one thing that I could probably just research, but I've been kind of busy this week. But I was thinking this week about the sort of RICE protocol, because that's, in our training back in the day, that's sort of what was taught. Right? You have somebody who's sprained their ankle, some kind of joint injury. Like, what are the first steps you take, and then what conditions are going to promote healing. So it's something that doesn't warrant necessarily an orthopedic visit, right, that you're seeing in the primary care setting. I just feel like most primary cares, and again, I'm not speaking for everybody. I'm sure there's some very, very up-to-date folks out there, and they're great. But I myself would love to know what current data supports when it comes to treating an acute injury, like, let's say, an ankle sprain. That's a fairly common one. So that's one of the areas I would love to pick your brain about if you're
Sure,
willing to. Yeah.
that's a great question. Yeah, the RICE protocol is pretty outdated at this point. We've been through so many iterations of different abbreviations of protocols, but as I'm sure our audience will find out, the answer is always it depends. Our
Okay. And
favorite our favorite
with
reply to every question.
yeah, that's the correct reply. That's a correct, nuanced scientific reply,
Yeah.
if you ask me. But I was gonna say, I guess it would make sense for us to say what RICE is, what it
Yeah.
stands for. So if you want to start
So,
with that.
so, so
Yeah.
generally, the principle was okay. If you have an acute injury, let's say a ligament sprain or a muscle strain, or even a fracture of a bone, you would want to reduce as much inflammation as possible, displace that fluid and those inflammatory products out of the area, immobilize, compress, right, to help with the fluid buildup, and rest. So RICE stands for rest, ice, compression, elevation. What we have seen and found in the clinic and in real world is very rarely do we ever want to rest and ice and compress. Now, obviously, there are absolutely times when you should do that, especially with a fracture or more serious injury. But if we're dealing with a lower level muscle strain or ligament sprain, we really want to get as much healing factors to the area as possible. So I think of what I do as how can I manipulate blood flow to a region to get some sort of output or outcome, right? I'm a physical therapist. The only tools I have are yours, right? Your body, your tissue. So I'm trying to use those tools to get some sort of positive outcome or objective change. So if we're with blood, it's carrying oxygen, all the healing factors, right? We want that tissue to be well perfused. We want a lot of blood flow, and we want to get some light strain through it, right? Some lengthening, some shortening of the tissues. That's what's going to allow more perfusion, more blood flow, more oxygenation, and allow the tissues to actually heal at a much faster rate. So if we're dealing with something like an acute ankle sprain, yeah, we want to start to weight bear as early as possible. Now, you don't necessarily want to put a hot pack on it in that first 24 or 48 hours. Depending on the swelling, you might want to do a little ice for the first 24 hours. But it's more of a mindset. Okay, what tissue are we dealing with? If
Mm.
we know the level of injury of that tissue, and we know the stimulus that it will allow it to move in the right direction, we can kind of put some strain through that. So that's kind of a convoluted way to say, generally speaking, when we're dealing with soft tissue injuries, as long as it's not a complete tear of something, we want heat, warmth, tissue warmth, and movement.
Okay, so, and correct me if I'm understanding it incorrectly. So, in that initial phase, right? So, someone sprained their ankle, so there's obviously going to be pain and there's going to be swelling. So, I guess is the sort of the rationale for potentially using ice at that time is to try and decrease the swelling and decrease the pain as well. Is that like sort of the rationale for that in that initial period, and then switching after the 24 hours to some kind of warm sort of pack, heat pack or something like that?
Yeah, yeah, that would be the line of reasoning for something like that. I don't take pain into the picture very much when I'm looking
Okay.
at a total body of function. That is, that's a whole nother conversation. But we need to remember what inflammation is and what it
Mhm.
does, right? Inflammation is just the first step of our immune response. It's how our body changes or heals or recovers from something. Inflammation we gets a pretty bad rap, I would say, and
Mhm.
especially in our current culture. But that is kind of the spark of the rest of these systems to allow our tissues to heal or recover. Right? Would you agree? I think I lost you for a second.
Yeah,
All
I
right, you're
lost you for a
back.
second. I got you back now. Yeah.
Yeah. Did you get would you agree with that sentiment?
Yeah, actually, so my thinking around this is that, yeah, so acute inflammation, the way that I understand it, is exactly that. It exists for a reason to trigger your whole system, to bring blood flow, to bring all of these sort of healing factors, to trigger these cytokines and um, all of those things for this injury to heal. So then comes my next question then, that is the use of non-steroidal anti-inflammatory drugs, so things like ibuprofen, is there, and I don't know the data on this, so I guess it's something we could look into, but is that actually detrimental possibly to the healing process? Like, should we be controlling pain with something like Tylenol instead, or something that's not anti-inflammatory per se, um, in order to allow as much acute inflammation? Because you said that it's been vilified inflammation, and I think that there it's important to distinguish between chronic kind of low grade inflammation in the body, like things like not getting enough sleep and being chronically stressed, things like that will create chronic low grade inflammation. But this is acute stress, acute inflammation. So I wonder, I don't know, do you know the answer to that, if ibuprofen should be avoided?
So it depends, my
Yeah.
friend. It depends. So it depends what your outcome is, right? This is where when we're practicing medicine, it's easy for me to say, but we really want to consider the entire person
Mhm.
and the entire scope of time, right? Not just a snapshot of that person or that body region at that particular time. Would you want to use an anti-inflammatory with an acute injury? Sure, probably. Yeah, minimize pain. The what I would encourage people to think more about is, okay, what's the downstream effect of pain? Generally, we when we feel pain, we are more hesitant to move. We know that we need movement to improve. So if you can do something or take something that will reduce your pain and allow you to move a little bit more freely, then to me, that's a very valuable trade off, right? The movement is the medicine there.
Okay.
If you can blunt that pain response a little bit and get in the movement, or as I like to think about it, the stimulus for change, that's kind of what it's all about. And when we're thinking of like on a long term, does do anti-inflammatories blunt recovery from strength training, for example? Or an even better way to consider this is, what is the reason for let's take steroids, for example, anabolic steroids. The steroids are not making the muscles grow. The steroids are allowing your muscles to recover from a stimulus much faster so that you can do more again sooner, right? So we're dealing with a total volume of work or stimulus to get some sort of desired response. So these are the things I wish people would consider a little bit more when they're trying to make these decisions of, okay, uh, what's more important right now? Me minimizing pain? Well, sure, if you're going to do something with it,
Hmm.
right? Or if you're not going to do something with it, then yeah, minimize pain and get that inflammation out of there. So it's always a nuanced answer. You're going to have a million different opinions if you ask a million different providers. But what are your thoughts on it from what you see in your practice?
So I don't see as much acute stuff these days anymore, right? So my practice is kind of more focused on chronic disease, but occasionally we will. Um, for me, controlling pain is pretty important. Yeah, so I'd agree with you on that because um, just first of all, quality of life. Like someone just being miserable and in pain, I want to avoid that as much as possible, so that they can get on with their day and not be suffering in pain. Yeah, my question came more sort of like I was academically, thinking about this. Like, okay, if inflammation is healing, are we giving anti-inflammatories? And I think your point is a valid one. Makes a lot of common sense, right? Is that if we are decreasing some of that inflammation or some of that pain, and now they're able to um, put some weight on that foot a little bit earlier, or get some physical therapy a little bit earlier, or be less hesitant during that. I think net benefit, long term over the course of that injury,
Yeah.
uh, the benefit is there, and so I would agree with you 100% on that. I guess sort of going back to my original question, if I had, so I'll be very more specific, just so we have a kind of specific example to work with. So let's say I'm dealing with a 42-year-old woman. She's a lawyer. She, twisted her ankle going up the stairs to the courthouse, and wants to get, back to work as soon as possible. Got a lot of cases, etc. Coming in and saying, "Hey, help me out," right? Like, what would be the steps to take? Typically, I'll tell you what's going to happen in most primary care offices is you are probably going to get a shot of an anti-inflammatory, right? Um, or a steroid, depending on the degree of inflammation and which provider you seek. Some are a little more trigger happy with steroids. I'm a bit more cautious around steroids just because I deal with a lot of folks that do have metabolic disease, right? So they do have high blood sugar. And so do I really want to spike their blood sugar? I might, depending on again, like you said, it depends, like with risk versus benefit, right? If I'm doing that, what am I gaining from it? But I would probably put someone like that in some kind of immobilizing wrap, not something too rigid, probably something pretty flexible, just enough to protect the joint in the first few days. Maybe even some kind of an ankle brace, even you can get over the counter, Walgreens or whatnot. That would be my approach to this. I would ask them initially to ice it, because again, my training is kind of old when it comes to those things, which is why I'm trying to update it.
Mm.
And then beyond that, I probably would place the referral to a physical therapist, to be honest, because I just feel like the earlier we get those things in place, the better. They tend to happen too late, in my opinion. People end up at the physical therapist office like weeks too late,
Yeah.
in most cases, at least in my experience.
Yeah.
That's kind of how I would approach it, and then just make sure that their pain is controlled, right? So if it's like really severe pain and we need to step up the pain medication, that we also do cautiously because of the problem with the dependency and opiates and things like that. So we're always going to look for what is the um, what is the lowest right level of pain medication that will achieve the desired action. So I'm not
Yeah.
going to jump to Vicodin or something like that, even though sometimes we might end up there. Hopefully we get that pain managed.
Minimal clinical significant dosage, we can
There
call
you go. Thank you for
it. Yeah.
putting it in smarter terms.
No.
Um, but yeah, so that's how I would approach it. So how would you pick apart my approach, or what would you add to it or take away from it to make it more relevant or better?
I don't know. I don't know that I would add or remove much from that. And I think the overarching theme here is we really need to act as a team in medicine a little bit better, right? So that is perfectly reasonable for you to see a patient in your practice with your specialty and your background to do that, right? Immobilize it, educate the patient, maybe minimize weight bearing, because I am assuming, don't have the background to like differentiate between a grade 1, grade 2, grade 3 sprain, or like maybe go through the Ottawa ankle rules, which is like a clinical way to see if somebody needs an X-ray, right? Um, so the key there is getting them to the appropriate provider quickly, right? Because if somebody's non-weight bearing for a week, that's going to be really detrimental for the long-term outcomes of this particular patient. But if you can get somebody into a therapist or the appropriate provider the next day, that's huge. Then, using your example, I can go through there and stress test all the ligaments, see exactly what might be going on, look at the joints, look at the rest of the kinetic chain, see if there's hip, knee, lower back stuff going on that might need to be addressed. Get a better understanding of this person and their tissues and what their tissues could tolerate. Because just like you were suggesting with the minimal dosage of pain control, I want to find the maximum dosage of movement that this person can tolerate without going over that threshold of pain or injury. Now, a little discomfort, that's another discussion, but we want to strain the system or the tissues as much as possible to get that recovery process starting. But that, and I refer to it as dosage with exercise, right? We want to achieve that correct dosage. And just like I wouldn't see somebody in here and recommend pharmaceuticals for blood glucose, like that's way outside my scope. I have no idea what I'm doing there. I would, if I had a patient that was maybe displaying some signs of low blood sugar, I would hopefully refer them to you quickly. Like, okay, we're in the middle of a plan of therapy plan of care. Let go see Dr. Vahid. He go see him quickly, and we can get that sorted out hopefully, and then we can come back around and keep doing our thing. Like
Yeah.
we need to have a better team approach to this.
So and we're kind of drifting to another topic, which I like. So I want to stay on this for a second because I think it's really important. So what you just described actually um, is where I think healthcare can improve in our system, right? Is that we all have our training, and that it needs to be like that. Like not everybody can know everything, right? So we pick kind of the things that we're gonna be really good at, and we focus on that, and that tends to be the majority of what we see. The problem is that sort of the communication between members of your healthcare team. It's there, but it's very hit or miss. Like you'll have some providers are really good about reaching out, even calling the other provider and say, "Hey, look, this is what we're dealing with, just so we're on the same page. I'm adding this medication. Are you cool with that? Blah blah blah." That's ideal. The problem is that ideal doesn't necessarily fit in our current healthcare
Sure.
system, right? Because you have high volume practices that are dealing with overworked staff, from everything from the front desk all the way to back office and everything in between. And so you already have a bunch of people that are stretched thin. And then to ask those people to now kind of carve out time to go and have a 10-minute conversation with another provider who is in the same scenario, by the way. And so trying to get those schedules to connect, you know what I mean?
Yeah.
So it's not necessarily feasible.
Yeah.
But it doesn't make it any less important for that to happen, because I think ultimately currently the patient is having to sort of play broken telephone,
Yeah.
and kind of like, you know I've been a patient myself, you've been a patient, I'm sure. And when you're in a doctor or a healthcare provider's office, and you're in a vulnerable state, right? You're not there because you're there just to high five everyone. You're there because you're dealing with an issue, and so that you're in a stressed state to some extent, right? And they're giving you information, you're trying to absorb as much as you can to sort of, okay, how many of those was it, and how long, when do I come back, and you're already stressed out, you're trying to make sure you don't forget anything. And then now you leave and you might forget one or two things, that's completely normal. And then now you're trying to relay that information to your other healthcare provider the next day, who's part of that sort of treating the same condition. And so you can see how that becomes problematic, because now that person goes, that doesn't really sound right. They don't know what they're doing, right? Meanwhile, it might have just been like that information was not communicated completely, which is totally understandable.
Yeah.
And now, so it's almost like sometimes I feel there's a competitive, like, oh, they don't know what they're doing, let me fix this for you, right? And then same thing happens on and on and on, and you just have the poor patient here kind of bouncing like a pinball through everybody, and hopefully the care is somewhat coordinated so that they heal from this. But I don't know, like, I don't know how you feel about that, but I think it's a really important piece.
My friend, I mean, there's about 100 different things I could parse from that. I would say, let's see, where should I start? First of all, let's not pretend that you and I sitting here are in some way like superheroes, right?
Mhm.
Our particular practice model is concierge out of network, right? We have the luxury to be able to communicate like this, or if I see somebody, I'm seeing one person an hour, right?
Mhm.
I could call Dr. Vahid and ask him a question. We can communicate really easily. That is not the norm for medicine, right? But me back seeing 16 to 24 patients a day, I'm just trying to get through the day, let alone trying to do peer to peers or call some sort of physician for post op protocols. It's just insane. It's not going to happen. But I think it is our responsibility as providers to at least reflect on who we're seeing, the type of patient we're seeing. Are there patterns? Are we seeing is there a lot of overlap in the type of patient that's walking in? If so, let's reach out to some of these other providers and educate ourselves on better management techniques, right? I
Mhm.
think that's perfectly reasonable. I think, and for the most part, people do that all the time. To your point about the patient, playing a game of telephone, absolutely. I mean, it's just we as humans and acting as historians are just awful. We have even memory. It's just terrible. It's not reliable in any measure. You add on that the stress of dealing with illness or an injury, and then being thrown into a world where this highly educated person maybe is using a lot of medical jargon.
Mhm.
It's not going to flow well to the next provider. And then on top of that, yeah, there's all kinds of egos in healthcare. I had a massive ego. I probably still do at this point. My and I have to control that. Like, I'll be honest with you, my knee jerk response to anybody walking in here and being like, "Yeah, well, this provider said this and this." My knee jerk response is always to poke a hole in that, and I have to almost every day. I have to like pull myself back and be like, "Calm down, Adam. Like, you're not. It's not a battle of wits with you and this other therapist or chiropractor or orthopedist. Like, see what this patient is saying and feeling, and let's use that information to our advantage." So there's the ego aspect. I'm not going to pretend to have any good solutions to that.
I
But yeah,
think just what you just did there, which was just admitting that, hey, sometimes I have that ego, sometimes that's my knee jerk response. I think that's an important step that doesn't get taken a lot, if I'm being honest.
yeah. I mean, I recognize that in myself, but I don't know how I would uh, fix that problem across the span of healthcare.
I don't. I think it is individual, right? It just comes down the way I look at it, because I also was always like, what was this person thinking? Like, why
Yeah,
are you on these medications, right? And almost every single time, the reason why I end up in that conclusion is because there's poor communication. So I've never spoken to this other physician. I have no idea what they're doing, right? So if there was even just a brief note or a short message, something to say, hey, this is what I'm thinking, this is why I'm doing this. So I try and have that conversation with myself instead, to sort of stop myself from poo-pooing somebody else's work, because I don't think that's good practice in general. It's a kind of fine line to walk, because you're also wanting to be an advocate for your patient, right? So you want to protect your patient too. So if you feel like they're not receiving care that is safe for them, or appropriate, or optimal, you do want to defend them on that, and make sure they are receiving the treatment that they need. But
yeah,
the way I try to look at it is, okay, this very same patient could go to the next person and misunderstand or remember what I told them, and it could just be a communication thing. So what I usually end up doing is I'll reach out if I have any confusion. I'll say, hey, look, I noticed you had them on these 3 medications. I'm going to make this switch. I just want to keep you in the loop as a courtesy. I don't want to be switching things around without letting you know. and then they may or may not get back to me. I would say if I had to pick a percentage, probably 25% of people respond, maybe less.
Yeah.
And again, not because they don't want to necessarily. I just think that the way the system is set up, not everybody, to your earlier point, not everybody has the luxury that we have of time with the patients and time in our practice, right? Because they're operating these sort of high volume practices.
Yeah. Yeah, I would agree with that percentage from my own experience. And it's, just kind of going back to the team approach. We really want to strive for putting all our heads together and trying to find the best route or plan of care for this human being, with all of our specialties, especially if it's a complex case. But it's just really hard. It's really hard on a number. Humans are also very complicated, right? Even just teasing out the subjective information, right, with a history taking, that's a whole skill set. There's a whole world of science and literature built around, motivational interviewing, for example. Um, so you're fighting all these battles, at the same time, and the best we can do is try to listen to and understand our patients, what their needs are, what their goals are, and how can we be the not influencers but arbiters of knowledge as best we know it and as best we can apply it, so we can kind of meet those goals. Um, at, to your point of poo-pooing other providers, yeah, there's definitely a fine line between, less so in my field because there's not a ton of risk involved with conservative management things.
Mhm.
I'm sure you see it way more, but there's very few things where I feel like, unless it's something that I feel is putting my patient at risk, then I'm usually pretty hands off in terms of, or if they specifically ask me like, hey, what's your opinion on this outcome, and even then I tend to be a little bit more gentle and kind of mirror their, um, I don't know, morals, ethics, experience in a way, because
Mhm.
ultimately, people are fairly set in what they believe and what they think is going to work. And I don't want to be the one to take that efficacy of a treatment away from them, right? And what good is that doing? Yeah.
Yeah, and another thing I do in those scenarios is, instead of kind of saying why is what they're doing wrong, I don't even necessarily use those words, because again, I don't know the full context of it necessarily. So what I'll focus on is, okay, here's my thought process. And by the way, I like being really transparent, excuse me, with my thought process with patients. So I do my thinking out loud,
Yeah.
because I've found,
Same.
again, because I do have the luxury of time, right? I understand that with my colleagues that have 5 minutes per patient, this is not necessarily feasible. But um, when I do think out loud, the patient is able to sort of see the rationale for the decisions, for the medication, or whatever other sort of protocol I'm putting into place, and they'll even sometimes see me change my mind in between, like, well, you know what, hang on a second, why don't we try this first, and then we'll, if that doesn't work, we'll try. And they, initially there's a bit of a look of confusion, kind of like, hang, like, are you sure of what you're doing? Like, some folks will get a bit worried and they'll be like, you don't sound too sure. And I'll explain to them, this is so you understand why. Because otherwise, if I just say, okay, you need to take 2 of these and 5 of these and I'll see you in like a week, you go home and you're like, I don't know, like, I don't know what I'm doing, or do I trust this guy, do I just take his word for it? Some people do really well with that, but others, it does create some doubt. But like this, they understand it, and they are now, as I like to say, they're the most important member of their healthcare team, right? And so now I've also helped bring them into the fold, like, hey, this is highly dependent on you, and you following these instructions, and you stepping up to the plate as well. It's not, it's a dynamic thing. It's a team effort, and without you, we can't do anything, right? And so that helps also with that. And then now I'm not speaking negatively of anybody else's management. I'm just focused more on, these are the things I want to do. Let's try it this way. And I find that that positive approach, it's just better received, and I feel less of an asshole. Can I swear on podcast? Yeah, when I do,
Whatever we
when
want.
I like, I
No
just
one's
feel like
watching.
less of a jerk. I should say jerk. I feel like less of a jerk doing it that way, right? Because again, my colleagues are working hard, they're busting their butts, seeing high volumes of patients, and they're tired. Sometimes they'll um, they might prescribe something that's maybe not optimal, and I don't know, right? I don't know the full story, and so it's easy to judge, but I don't think it's the right way.
Yeah, it's super easy to judge. I do the same thing, and my patients make fun of me all the time because apparently I go into a very specific thinking or reflecting.
You're
Uh,
giving me Dr. Evil vibes right now.
yeah, blowing on the fingertip.
Okay.
Um, yeah, and that's, I don't know if that's a me thing. I don't think it is, but I think out loud as well so that they can see my train of thought or my logic or my approach or why, especially in my field when people are paying me to meet some sort of goal. I am not a fan of the financials behind it. It makes me very uncomfortable. So
Hmm.
if I've evaluated this patient and I think they need to see me twice a week for 2 weeks and then once a week for 4 weeks for this particular outcome, I'm explaining exactly why that is. Okay,
Hmm.
right? Well, early on, we're going to get a lot of neurologic changes. We need to continue to drive that motor forwards. That means we need to progress exercises at a higher frequency. And then when things enter into maybe more of a hypertrophic phase, then you spend more time with exercises, blah, blah, blah. I almost over explain my things. Maybe that's an insecurity I have just from the business side of healthcare, but I find, and I think most of my patients would agree that they find that really, really valuable. Again, that's we have the luxury and the time to do that with the situations that you and I are in.
Hmm.
It's really hard to sit there and explain um, certain concepts to somebody, especially if they're having a harder time explaining it, or more often the case, I'm not doing good enough a job to explain it. Right? You could have one. You and I have talked about this before. You have one concept that you're trying to address. You really need to have 5 different levels of explaining that for a particular person, depending on their background. Um, and if you're not getting through to that person, especially when we are ultimately trying to create behavior changes, I
Hmm.
would say is really at the heart of both what you and I do. Um,
Right.
Nobody's going to change their behavior, go through the massive effort and strain of changing a behavior, sometimes a major behavior, if they don't understand why, right? So yeah, those are my
So
thoughts.
let me play devil's advocate for a second.
Yes, do it.
Yeah, what are like some of the horror stories or situations where you've received someone, let's say from someone like me, from a primary care provider or other type of provider, that you've just had to kind of bite your tongue? I don't know. I'm curious. Like, what are like some of the worst messes you've seen in that sense?
You're putting me on the spot here. How can I
I
be?
am. You can decline. You can pass.
No, I'm not going to decline. I will
Okay.
never decline or pass. Let's think of one recently. You know, Manipulations is a big has always been kind of a big hot topic. So
Explain what the manipulations are for the layperson here.
a joint manipulation, or the what a chiropractor would describe as an adjustment,
Hmm.
is in physical therapy world, our joints have a total range of motion. Usually there's two bone surfaces together, usually a capsule around it. How much can those joints move along each other and like stretch that capsule, right? So technically speaking, a joint manipulation, or a what we call a grade 5 mobilization, even, you are taking that joint past its end range.
Okay.
Usually that involves a quick high velocity, like quick low amplitude, small movement. And you'll usually get the nice satisfying crack or pop, which is a cavitation, right? The nitrogen gases or liquid turn into gas, the little bubbles. Um,
So
what
this is so the manipulation is when they're cracking your joints, right? Like say they're cracking your neck, and that sound is coming from the gas that's within that fluid in the joint that's coming up, right? Is that
Yeah.
correct? The bubble that's forming. Okay.
So think of an enclosed environment, right? Like a balloon. If you change the pressure, let's say you increase the pressure in that environment, that is going to change the properties of the different molecules in there, right? This is just physics and chemistry, right? From our eighth grade physics and chem. So yeah, the nitrogen, that is our best guess at why we're getting that cavitation. The nitrogen, because of the increased pressure, the quick increase in pressure, that nitrogen is turning to little gas bubbles. So what we have seen in our world, from a physical therapy world, is um, there definitely is a reduction in muscle tone, meaning the muscles that attach to and around that joint will relax a little bit. They won't be as tight, and your joint range of motion will increase. Most of the time, that's a pretty short-lived treatment effect. I usually explain to patients like 20 to 30 minutes. So my thought is, okay, what do you do with that? That's kind of, you're prepping the tissue in order to achieve some sort of long-term change. What do we need to do to get that long-term change? So anyways, that's joint manipulations. But to
Mm.
your question, I personally would never have somebody with radiating pain down to the fingers, and they aren't able to apply any force through the triceps. That's not somebody I would manipulate their cervical spine, right? There's some pretty serious nerve impingements and impairments going on. Not something I'm comfortable with. Or for example, somebody with they walk in, they've had neck pain and some headaches, and now they've got balance challenges, right? Or even reflexive changes. Probably not somebody I would manipulate, right? A little concerning for spinal cord compression, cervical myelopathy. So unfortunately, I saw that recently from a provider. Not the best. Hopefully that person will be okay. But I don't. And just to be clear, that's not something I see often. But just when you
Okay.
raise the
So
question,
this was someone that had cervical radiculopathy. So they had pain starting from up here, kind of neck, going all the way down one arm. So the nerve is getting impinged at that level, the cervical, that being the level of the spine in that area. Um, and they went and got a manipulation. So someone cracked their neck essentially.
yeah,
And
it's
what resulted from that?
well, I don't want to give too much information
Okay.
away.
Okay. All right.
The patient was hospitalized. I could say that.
Okay. Okay. So it was
But
pretty severe. All right.
yeah, it was worse than that because it wasn't unilateral. It was bilateral symptoms, which
Okay.
that's should clue you into, is this a peripheral nerve issue or central?
Mm-hmm,
And
mm-hmm.
then when you're dealing with a cervical spine and you start getting balance issues, yeah, that's a little bit of a red flag for the old
Yeah.
myelopathy.
Yeah.
So I sent that patient to the hospital. I didn't touch that patient. They came in. This was a new patient. I hadn't. They just scheduled. I hadn't talked to them
Mhm.
on the phone or anything, and kind of revealed that in the exam.
That's
Um,
scary. That's scary for that patient.
yeah,
Hoping they're okay.
like I said, it's not a common thing, but that probably reflects more on the healthcare system or the volume that
Mm,
people are trying to do. Like they're not sitting down and really asking good questions, or doing a proper assessment, or screening for red flags, or doing their differential diagnosis.
mhm.
Luckily, in my world, there's not. That's a pretty rare occurrence. I don't see it. Just happened this past week, but that's, you just caught me at a random time, I guess.
Okay.
A lot of conservative interventions are pretty low risk. I imagine you have much more higher risks with what you're dealing with, but there's some things that annoy me in terms of what people are putting out there or saying. A lot of what really bothers me is the fear based approach.
Mhm, mhm,
You slipped a disc, right? Or you had such little spine in your central canal that if you got in one bad accident, you'd be paralyzed.
mm.
Or right, or don't do CrossFit, you'll explode your knees, or whatever the case may be. That's the stuff that really drives me crazy, and I see a
Okay.
ton of that because some provider is trying to push their services, and they're basically trying to say, hey, if you don't do this, this could happen, right? I see that all the time, and I have to bite my tongue because generally those people are still working with that person, and it's I don't want to get in the middle of that, but
Yeah.
slowly people will start to kind of hopefully, that is my hope, that I have a very educational type of practice here. It would be my hope that people can have a better understanding and take more control over how they choose to get whatever interventions, and just be a little bit more mindful of like, oh, okay, it's my body. I have so much control. We have so much information at our fingertips. Like we can actually look into this, right? What
Speaking
about?
of information at your fingertips, do you get a lot of your patients coming in and basically quoting TikTok or Instagram?
No,
Okay, cool. Because I
no,
get, I do.
do you? Oh
I
man,
do. I mean, not necessarily saying I'm gonna do this, but like, hey, I heard, such and such thing. If I took this supplement, that all of these problems would go away, or so kind of. They're usually um, pretty reductionist in the way that these recommendations are made. They're usually like very black and white, right? It's like, oh, you have these 8 problems, and all you got to do is this one tiny thing, and everything's going to go away, right? There's no room for nuance or for any sort of gray area. Which again, like you said, the answer, it depends as always. And I think, again, not trying to say, hey, you and me are these like super amazing scientists or anything like that. I mean, I think you're great at what you do. I'm pretty proud of what I do as well. But um, I find that anybody that has adequate scientific clinical training is going to be very hard pressed. Very, very rare circumstances are they going to give you a very black or white answer to a general question like that,
yeah,
because it does always depend, right? Like, what is the desired outcome here, right? Like, oh, should I eat this, is it, or I heard this is bad for you. Well, compared to what, right? Like, what's the alternative, and these type of things. And I find that it's frustrating for you to be in a position where you are suffering from something, right? So putting myself in the patient's shoes, you're coming to, a quote unquote expert on something, and you're saying, hey, I heard this will fix my problem. And you're saying, well, it's not that simple. And you're giving them this sort of very nuanced answer, very sort of like maybe gray area. That's frustrating to hear, right?
yeah,
Because you're like, dude, fix my problems, right? Like tell me, give me a guarantee. And that's the thing that with clinical science, there's sometimes we have pretty good outcomes to the point where we can almost guarantee stuff, but it's not common. I would say generally it depends on how the person responds to it or how much they put into it, depending on the type of treatment involved. So I totally get that frustration. And in that same way, for the same reason, it becomes so easy to fall prey to somebody who does give you that clear answer. It says like, oh, what, you have fatigue, and you have trouble sleeping, and you da, 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 and they list like 15 things. Oh, all you got to do, you got to inject your own urine. That's it. It's going to cure everything. You'll never get cancer, and da, 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 you know and somebody who's in pain, who's suffering, right? And when I say pain, I don't necessarily mean physical pain, like just suffering in some degree when it comes to their health. It's very attractive to hear such a clear cut, simple, like, boom, this is going to fix all my problems. And so that's
sure,
where people get preyed on. That's where, like you said, services get pushed on folks, buy my snake oil, or buy my program, or buy my whatever. Which, anyway, that's just me ranting because it's something I deal with all the time. And I get really frustrated because um, I sound like the guy who's not trying to help, right? Because I'm giving the sort of like the drawn out answer.
yeah.
And it's frustrating because you're actually, inside, like, I'm actually trying to help you. This is the real information.
You're like the stern grandmother instead of like the cool uncle.
Exactly. Yeah. I want to be the cool uncle, but I can't. I can't be the
Sorry,
cool uncle. I just ethically,
everybody,
I can't.
not everybody can be the cool uncle. It's okay. Yeah,
Yeah.
it's. I know, man. It's certainly a frustration. There's also another side of that, from in terms of just like interventions, that we will probably do a whole separate podcast on this in terms of the efficacy and placebo effect
Mm.
of if a patient or a client has a lot of confidence in said intervention. So that's a whole nother world. I'm going to table that conversation
Yeah.
for now. But yeah, I want to ask you,
Yeah.
in the last 1 or 2 weeks, I'll give you a specific time frame.
Okay. Now
What's
you're putting me on the spot.
yeah? What's the craziest shit you've heard?
Last 1 or 2 weeks hasn't been too bad because I had a couple of days off this week. So let me see. In recent history, the craziest thing that I've heard in terms of like a recommendation made to a patient, or just in
Yeah,
general?
recommendation, patient belief, patient goal.
I don't know. I don't think I've heard anything too crazy. Like I'm trying to think of something extreme. Nothing too extreme recently. Let me see. I'm gonna if something pops to my head, I'll let you know. Yeah,
Well,
if you
that
have any,
so I find that interesting though, because I kind of had a hard time thinking of something on the spot.
yeah,
So the question then becomes, okay, we see all this shit on social media, and we're kind of shaking our heads like, oh my god, there's got to be, look at all these views that this person got.
yeah,
Like people actually believe this. This is horrible. Like, are people really believing this? Are they really internalizing
they,
it? I
they
don't know.
are. They are, and I think so. So the reason, for example, um, when people walk through my doors, they've already sort of self-selected, and
Oh
I'll
shit,
explain
you
myself.
got doors?
Huh? Yeah, I have
I gotta hear
multiple
what you
multiple doors. No, so sorry, you got me now thinking of jokes. But anyway, so when people walk through here, they already kind of have an idea of who I am and how I practice, right? And so they've kind of selected, yeah, this is the type of physician I want, right? Like I'm looking for somebody who's versed in these areas, etc. So it's never occurred that I have somebody on the carnivore diet walk in here and try and convince me that they should stay on a carnivore diet, right? Usually it's somebody who may have tried something like that, or they might be on keto or some other kind of dietary protocol, and they go, look, I've tried all of these things, I've done these 4 different dietary patterns, nothing's working, what do you think, etc. And then we have that sort of long conversation about what that looks like, and we could probably do several podcasts on just dietary patterns, because I think that's fascinating. um, so I think the most sort of I guess, to answer your question, the craziest stuff I hear typically is around diet and what people have convinced themselves is the way to go because of something they might have heard on social media. Now, the interesting thing is, yes, I think people are doing it, but they're all having slightly different experiences, right? So let me be more specific, because I think it's easier to explain it if I use a specific example. So let's say that I do have somebody who is on I said carnivore diet, let's do that. Who's on a carnivore diet? And somehow they end up in front of me, right? And do I believe and they say, hey, I went on the carnivore diet, my skin cleared up and blah 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 blah, and I've never felt better, etc. Do I think that they're lying and just somehow trying to push some agenda? No, of course not. I truly believe people when they say that this dietary pattern has benefited me. I believe them, even if I disagree with the dietary pattern. I believe them because what incentive do they have now, unless there's somebody selling something from that sort of pattern?
Right.
They have.
You believe that? Do you believe that they believe that, or do you believe that it actually happened?
I believe that there are improvements when we eliminate certain things from our diet. So
Okay.
the thing is that not everybody's well versed in the scientific method, right? They're quite frankly, very few people doing these things are well versed in the scientific method. I'm average at the scientific method because I haven't done research in so long, right?
Yeah.
So um, that being said, so let's say if they are on a very sort of restrictive diet, very specific diet like the carnivore diet, they're eliminating a lot of things. They're eliminating a lot of processed foods. They're eliminating tons of different things. And so they, instead of saying, oh, that one particular food I may have had an issue with that was removed is the reason why I feel better, they go, no, 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 it's the fact that I'm eating this liver and fat and da da da, whatever it is that they're eating. And so they jump to that conclusion really quickly. And then it becomes like, because they do feel better, they really feel strongly about it, right? Because now here you are telling them, no, they're wrong. And they have living proof that, dude, I feel better, I'm doing better, right? A lot of the negative effects from something like carnivore diet will take time to show up in your labs, and if you're not doing labs, you're not going to get a heart attack because you ate 10 steaks last week, right? It's over decades of time that you're consuming large quantities of saturated fat, and eventually these plaques build up and one of them might break off, etc. Arteries get narrowed, whatnot. We can talk about all that later. But so I feel like they truly are receiving some kind of benefit, but they are misled into thinking into the way they're thinking about it. And so I don't subscribe to, there's one diet to rule them all. I don't think that's realistic.
Yeah.
Yes, there's a lot of elements in different dietary patterns that overlap, and there's robust evidence to back it up, like increased fiber and adequate protein intake and decreasing saturated fat. There are things that we know through meta-analyses, tons of randomized controlled trials, uh, to be true. But again, I think the best diet is the one that's closest to bringing you to your optimal health, that you're willing to eat, that you have access to, right? Because again, those are very privileged conversations. That's the fact that you can choose out of like 5 different dietary brands. Not everybody can do that, right? Not everybody has
Yeah.
access to those things. But anyway, I give you a long drawn out answer, but I think that those tend to be the moments in this, because I'm in my consult room, in this very room, where I have to sort of manage my reactions,
Yeah.
right? Like I hear something dietary, I'm like, well, okay, hang on, I don't, let's not react, don't do a facial expression, do anything, just listen, and then break it down, and let's see how we can move forward and benefit them.
Well,
But
I'm probably going to have to send in a what do they call it? Secret shopper.
okay.
It's called a secret patient. I'm going to have them camered up and mic'd up and see how you respond to their outlandish thoughts around diet and nutrition. Well, my response to something like that, if I could indulge you, and
Mhm.
I did not think that you thought one way or another about it, but I would look at more of the positive of, oh, that's interesting. Look at these changes you made when you changed your diet. Let's reflect on that. Look at how powerful it was to make this change.
I
What do
love
you
that.
what do you think those changes were? Oh, look, you weren't eating any of this. Yeah, protein's great, but you know what else is great? Some, I don't know, vitamin D, baby, like, or
You're
go
putting
go
into
fry me,
practice
brother.
motivational interviewing. That you're using some of
Yeah,
that knowledge. I think that's amazing if more people did that, because at the end of the day, you're not trying to win an argument with the person who's coming to you for help. That
yeah,
doesn't make sense, right? Like, I don't need to be right to stand up and say, there you go, I proved you wrong. No, I'm trying to help you. And
yeah,
so, I'll convey the information that's available to me today, what's relevant up till today. Tomorrow research might say otherwise, and I'll change my tune, right? And we'll have a different conversation. But I agree with you. I think that is the right way to do it, is to focus on the things. The fact that they took the time to think that they might need to change the way they're eating to improve their health, that's a huge positive. A lot of
huge.
people a lot of people can't take that step, right? So
Yeah,
yeah, I think that it does kind of speak generally to us as a society, how polarized we can get about everything, right? And for some reason, dietary patterns happen to fall in there, and it's one of the more common ones where people will be at each other's.
yeah.
Uh,
It's so personal though, right? Like,
yeah, yeah, yeah. It gets heated. Like
literally
I've had
hurting
it.
you.
I've had heated conversations with some colleagues, and then I'm thinking, like, why are we getting so upset about this, right? Like, just eat
Yeah,
whatever you want, man. Like,
yeah, yeah.
you
It
know?
goes quick, and I think the overarching theme there is reflection, right?
Yeah.
If we can try to allow ourselves to reflect more on everything we're doing, I think we'd be a lot better off. The choices we make, the people we interact with, the reactions we have to others. Yeah, I think that's lacking quite a bit. We're a little too busy these days. Yeah,
Oh yeah. Yeah.
yeah. What's your what's your biggest hope for the next year? Would you say, in terms of how you practice? Like, what would you like to see? Either I'll keep that question open ended instead of me trying to.
Okay. Yeah, I like that. That's a good one. My hope. All right. So I guess I could look at it from several points of view, and I can answer it on each of those, right? Because there is, what is my hope as a physician, a clinical practitioner. What is my hope in general for the type of work that I do, and how that could evolve. um, what is my hope as a business owner, right? Those things tend to be pretty aligned, but the sort of action points on them might be a little different. So my hope, I would say, my biggest hope, and something I've been thinking a lot about, and actually being fully transparent to whoever's listening, part of the reason why we're even chatting, right? Is my hope is that I can create this community, or become part of a community of other experts that tend to share the same passion and vision for healthcare. Because I think that's ultimately, like, if I refer a patient of mine to someone, I mean, everybody's got to go through the training, right? They got to do their, some version of a board exam or whatnot. So there's always like a very standard level of, you need to at least know this much, right, to practice this thing. So generally speaking, most folks out there can take care of virtually anything, but the patient experience varies so widely, and it does because of these things, those sort of soft skills, right? The ability to look at other elements of their life and see how it might be affecting them. Like the example we gave of, like, the lawyer lady who sprained her ankle. Like, you said something I found interesting, that, yeah, I would probably do a wider analysis and look, is there a hip and a knee problem? Like, why did she roll her ankle? Was it just, like, poor footing, or that she was wearing like a heel or a shoe that wasn't stable, or is there something deeper, right? So finding others that are experts in their own field, that ultimately really love what they do, and it shows. It's hard to hide that, right? And patients can tell, I can tell, like, everybody can tell. When somebody's just like, like, burnt out with what they're doing. Um, so that's one of my hopes, is to continue to grow that. And I'm really grateful to have met you. I've met several other experts in different areas. Hopefully we're going to have one of them join us fairly soon on one of these episodes, Pega, who's a clinical psychologist that I'm going to be happy to have joined the conversation.
Oh yeah.
So that's probably one of my biggest hopes, is that I now have, like, all of these different brains to pick, and folks that I can work together and collaborate with. I feel like um, medicine, healthcare in general, has to be collaborative. I mean, it is, but I just want to feel more of that for my own sort of, I guess you could say, career job satisfaction. I really thrive with that. Like this, chatting on a podcast like this is really fun for me. You know what I
Yeah.
mean? This is not work. This is, I get to ask you questions. We get to kind of vent a little bit, I guess, as well.
Yeah.
Um, so that's my hope there. As a business owner, yeah, I want my practice to thrive, right? So if I'm being transparent, I'd love to see that happen, and because as that happens, then I can bring in more services. So really, my long-term goal here would be to have um, a lot of things within easier reach of my patients, right? That they don't need to jump through so many hoops to get the different services they need, and that's sort of a long-term plan that I have ultimately, and I'm still figuring out how that's going to work logistically, et cetera. I guess that's my hope over the next year or two, to get these things moving along. How about you? I'm gonna punt that right back at you.
Yeah, no, I love that. I think we align on a lot of things. It sounds like. I'd be curious to see what you feel meets the threshold of, like, having under one house. I remember jokingly one of our previous discussions. We got all excited about business modeling and planning, and we just recreated the insurance model.
Yeah, yeah. We're like, oh wait, that's
Ah,
insurance.
crap.
Yeah.
Yeah, what am I most excited for? Or I don't even remember the question I asked. What do I hope to see in the next
Yeah. In the next year, what is your hope?
year? Let's see. I would love for there to be more nuanced discussions, and for more people to have the time or make the time to really hear other people out, and accept and value other people's experiences. I think we just need a lot more of that. I think it's so hard for us to step outside of ourselves, and that really limits our exposure to things, our education, in a number of areas in life. And I think we just need a little bit more diversity in everything we do. So, in terms of how that relates to healthcare, I don't know. I'm hoping you and I talking and getting more people to chat about stuff will expose people to different ways of thinking, or different ideas, current topics in healthcare, or even different ways to approach a problem. But I would say mostly my hope is people being more reflective. I'm pretty big on the reflection, so I'll go with that.
I
Along
like
with
that.
everything, can I just say ditto?
Yeah,
Yeah,
yeah, you can, you can.
yeah, crushed it.
Yeah,
No, that's
awesome.
awesome. Well, this was fun.
Yeah,
This was fun, man. I think we covered a lot, and we will cover much more. Hopefully, we'll get some other folks on here too, and pick their brains about
absolutely.
things that they see. But yeah, I think kind of the overarching theme here, or what you and I would like to get into are current topics and trends in healthcare,
Hmm.
um, treating humans, and
Yeah.
all of the interactions that surround that, the terror, the humor, the sadness, the joy around that, and then just getting a better understanding of what providers do. I know one of the first questions I ask my patients is, "Have you had physical therapy, and or tell me what you think physical therapy is?"
Hmm.
And maybe we'll do an episode on the responses I've gotten. But I imagine you, in more of a newer field in lifestyle medicine, you probably have some similar issues in like educating folks on what exactly it is you do and what you excel at.
Yeah, I like to say it's actually old medicine, right? Like it's just that we've been able to articulate it around certain pillars of health, and maybe on another episode I can go into depth on what that is, what lifestyle
Yeah,
medicine is. But yeah, it's very few people are out there googling, hey, lifestyle medicine, or even know, even my own physician colleagues, unless they're kind of exposed to the College of Lifestyle Medicine or anything like that, or other practitioners that do
yeah,
that, they tend not to know. I was one of those doctors, right? Until I realized, oh, I've been practicing lifestyle medicine for a long time. I just
yeah,
didn't know that's what it was called, right?
yeah.
So,
Same. Yeah.
yeah,
Well, that'll be our teaser for next episode.
there you
Next
go.
episode, learn what physical therapy is and what lifestyle medicine is.
I like it. I like it.
Awesome.
Yeah,
Well,
fantastic.
always enjoyed chatting with you, and we'll see everybody next time.
Sounds good.